The NHS in the past 75 years has grown into one of the largest publicly funded healthcare systems in the world.
There are over 350 careers now.
The life expectancy is increasing nowadays with our advanced technologies and everything, which is very positive.
NHS is really accepting of internationally trained nurses to be part of their staff.
That's why you see people from all over the world are working in the department. So yeah, it's quite nice to see people and learn about them, their culture.
And the biggest thing I would point to are the clinical improvements and the innovation that we've seen that are keeping people living longer.
I think probably the greatest impact upon our population from the NHS has been the treatment of infectious diseases.
When the NHS started in the late 40s, there was no such thing as an infection control nurse. And now we've got infection control teams that are multidisciplinary.
Mortality rate is so much better than it was back then, and some of the preventable diseases that were back then are now no longer around.
So we've spent a lot of time looking at improving where people have their babies, where's the safest option for them.
So with focus on burnout, mental wellness, physical wellness.
From my perspective, this is the most exciting time to be in the NHS, because it'll be the things that we do today that we look back on in 30 years' time that have created the new NHS. So we are in charge of shaping that new legacy.
A workforce that thrives and an excellent patient experience being the centre of all decision making.
You need people that are going to love it, people that are going to want to look after people.
I worked in corporate industry before this, and I think the one thing that should be changed is having some joined-up thinking.
I would like to see all wards working fully digital, with a fully digital EPR implemented.
More beds, and also the capacity needs to be increasing to accommodate those people.
Much more sustainable, much more forward-thinking, better use of technology, a real investment in communities and in places. I think we've got a real potential there to unlock something quite special.
So first, to get rid of the menus, yeah?
I think at the moment we're currently struggling with recruitment, and therefore it would be really good to see innovative recruitment strategies to improve this.
I'd like to see some really good, exciting ideas on how we can retain staff.
In the future, I'm excited to see how flexible working complements the corporate functions.
In the future, I would like to see even more choices of food.
Built on the principle of free at the point of delivery, when people need it, not based on their ability to pay.
The way that we are collaborating, not just between NHS organisations, but partners in the wider community, and most importantly, with the people who live in our communities and who use our services.
There would be more staffing to make it bearable and more enjoyable and distribute the work.
I would like to see more equality, diversity and inclusion, because as they say, if you can see one, you can be one.
I would like to see just a continued improvement, so that time and effort spent on listening to what's working well, but also what's maybe not working so well and how we can improve that.
Essentially, I just want to make it a better patient experience for everybody that comes to access our services.
As an American, I can really appreciate the NHS and that it's free at the point of entry. Because back home, unless you had really good health insurance from your employer, you really struggle to get the treatment you need, and you may have to go without.
Patients here are actually very fortunate to have some of the care that they do have compared to what people where I come from receive.